Hello and welcome to this explainer. We are going to talk about what it means when someone is diagnosed with a hepatic adenoma. Our goal here is to give you a really clear, straightforward guide so you can better understand the specific type of liver finding. So, maybe you've been told you have a spot in the liver. Hearing those words can be really upsetting, I know. And a lot of time, this kind of thing is found by accident. When you're getting a scan or something totally unrelated, it can bring up a lot of questions and a lot of anxiety. But this is a journey we can absolutely navigate with clear information. The very first thing to know is that this finding is actually more common than you might think, and a lot of these are benign, which is just the medical term for non cancerous. There is a well established process that doctors use to know exactly what this is and tell you what needs to be done. Okay, with that in mind, let's focus on one specific type of benign finding, the hepatic adenoma. What exactly is a hepatic adenoma? Well, it's a rare benign tumor that's made up of your own liver cells, which are called hepatocytes. I really want to emphasize this point. It is not a form of liver cancer. It is completely different type of growth, and because of this, it has its own unique characteristics and its own unique management plan. Now, this is interesting. This number tells us a big part of the story. Hepatic adenomas are found way more common in women than in men. We are talking about a ratio of about 9 is to 1. And that statistic right there gives us a major clue as to what might be causing this. And let's look at some causes and risk factors as the next logical question. Why do these even happen? The answer is very closely tied to that number we just saw. The main risk factor by far is exposure to hormones, specifically estrogen. In fact, these tumors were incredibly rare before oral contraceptives or OCPs became widely used in the 1960s. And while birth control pills today have much lower levels of estrogen, they are still considered a significant risk factor. And this chart clearly puts this into perspective. If you look at people who do not use oral contraceptives, the rate is about 1 per million, but for those who do, the number jumps up to something like 30 to 40 per million users. And that's a big difference. And it really highlights that hormonal connection. Now, while estrogen is the biggest piece of the puzzle, it's not the whole story. More and more research is showing a link to metabolic health. So, things like obesity, metabolic syndrome, and in men, we know that anabolic steroid use can cause this, and in very rare cases, genetic conditions can be involved as well. Okay, so now when we find hepatic adenoma, there are two main concerns we think about. It's really important to understand these risks and also to put them in context. So, what are the two primary risks? The first is bleeding. This risk goes up quite a bit once an adenoma is over 5 centimeters. The second is a risk to become cancer down the road, and that is also generally in a few specific situations in men, in tumors larger than 5 centimeters, and in those with specific molecular subtype driven by beta catenin. Don't worry, these subtypes are just variations which we can detect with biopsy or imaging. And knowing the subtype helps us guide you. And this brings us to the management plan. Because we understand the risks and we have a very clear, well established pathway for managing these adenomas effectively. So, what happens now? That's probably the biggest question on your mind. Let's just walk through the typical steps your healthcare team is likely to take. The approach is very logical, it's step by step. First, we modify any risk factors. This almost always means stopping oral contraceptives, might also mean working on metabolic health like losing weight. We use advanced imaging to get a really good look at the adenoma, usually MRI. Third, for smaller ones, those that are less than 5 centimeters, the standard plan is just surveillance. That means we just follow with imaging to make sure it's stable. For some people, especially if adenoma happens in men, it's larger than 5 centimeters, or you have a high risk subtype, you may need a surgery. This is the key takeaway. The management is not a one size fits all, it's a personalized plan that's based on the specific subtype of adenoma you have, size, gender, and your overall health. Every single decision is tailored directly to your risk factors. So let's quickly summarize the important points. Hepatic adenomas are rare, non cancerous tumors strongly linked to hormone use and metabolic risk factors. Main risks are for bleeding or small chance for cancer. A personalized management plan exists for you. Thank you.